Welcome everyone to this session. But before we begin, we want to take the opportunity to thank Dr. Rina Malik for her initiative in organizing this incredible community event for the South Asian community, and with her incredible women physicians who are helping to bring this together. So thank you to everyone and all the organizers. And welcome to Dil Chahta Hai, how to keep your heart healthy and avoid the epidemic of heart disease in South Asians. I'm Dr. Sheila Sahni, an interventional cardiologist and the director of the Women's Heart Program at Sahni Heart Center in New Jersey.
And I'm Dr. Hafiza Khan. I'm a cardiologist and a cardiac electrophysiologist, and I'm in practice in Dallas.
So Hafiza, why did we feel that this topic of heart health was so important for our South Asian community?
Yes, so there are a lot of us South Asians. So 25% of the world's population is Desi, South Asian. But we account for 60% of all of the people with heart disease in the world. So although we're 25% of all humans, we're 60% of all of the people who get heart disease. So we're disproportionately at risk for coronary artery disease, heart attack, and stroke. And the average South Asian has a heart disease 10 years before the average American.
So for a man, that's 55,
yeah,
45.
Yeah, it's shocking. So I want everyone who's listening to know that this is not a disease of people in their 70s or 80s in our community. So the average South Asian man has his first heart event somewhere in his 40s or 50s, and the average South Asian woman in her mid-50s or so. So don't be lulled into a false sense of security that this is something that happens in people much older. 10% of us have gestational diabetes during our pregnancy. So women can have non-traditional risk factors for heart disease. Gestational diabetes is one of them. I had that during both of my pregnancies. And that leads to an increased risk of pre-diabetes and diabetes later on. So why is that, Sheila, that gestational diabetes could manifest as a risk later in life?
That's exactly the key here, is that women need to be attuned to these non-traditional risk factors. And that's why, as we're talking about this for South Asians, this is our opportunity to let women know that pregnancy could be their first stress test. You see small rises in blood pressure during pregnancy, which is a vascular phenomenon. The placenta is growing inside you. When that blood pressure starts to go up, or you develop what's called preeclampsia, that can double or quadruple your risk of having early heart disease later. So women need to be attuned to what's going on when they're pregnant, so they can see that cardiologist and follow up as they grow older. And I'm talking 40s after that first event. And you're right on the money there with gestational diabetes. It's also a very serious risk factor that leads to early heart disease. But women are at risk for other non-traditional risk factors, including polycystic ovarian syndrome, which is linked to insulin resistance, as well as having gone through cancer treatments, breast cancer treatments, chemotherapy, autoimmune disease. And menopause. These are non-traditional risk factors that haven't been, so mainstream, because we've always thought of heart disease as a man's disease, but it's not. It's an equal killer, and it's a woman's #1 threat.
Yeah. So my friends, if any of you have polycystic ovary disease, if any of you have been diabetic during one of your pregnancies, please, now is the time to make healthy life changes.
Exactly. So Hafiza, let's empower our community of sisters, of cousins, parents, grandparents, and spouses. Let's let them know that 80% of heart disease is preventable. What can they do to make sure that they don't become a statistic?
Number one, we need to have everybody get regular doctor's appointments. As women, we're used to that because we go for our gynecology appointments, our well women visits, but we need to make sure that the men in our lives are getting regular wellness checks. That means your husbands, your boyfriends, your fathers, don't wait for there to be a problem. Your mother.
Don't forget about yourself. Women are often so busy taking care of others, especially in ethnic cultures like South Asian women, and they often forget themselves. Equally important in getting to the doctor's visit.
Yeah, don't put yourself last, because women are the linchpin of the South Asian family. There are lots of people depending on us, the generation above and the generation below and our spouse. So get regular doctor's appointments, because you need to know your numbers. And those numbers are the traditional things: your blood pressure, your hemoglobin A1C, which is a marker for diabetes, your fasting lipid or cholesterol panel. And we South Asians, it's not just about LDL for us. We have HDL issues and triglyceride issues.
That's really key, I think, about when you get told that your numbers are okay. If you're South Asian, really run this by a cardiovascular disease specialist, because we have guidelines that changed 3 years ago in 2017, where 46% more Americans were reclassified because the cutoff has lowered. And also with cholesterol, I always get patients that tell me, my cholesterol was fine according to my primary doctor. Well, I ask them, show me the numbers so I can put it in the American College of Cardiology risk calculator. Because we don't treat to the numbers anymore, right, Hafiza? We treat to the patient.
Absolutely. That's called precision medicine. Precision medicine is tailoring it to you, the individual, with your particular genetic and ethnic background. So blood pressure, diabetes, fasting cholesterol panel. As Sheila mentioned, know your waist circumference. We carry our fat in our midsection, and fat around the midsection is more likely to correspond to fat in our body. We call that visceral fat. And then body mass index. So the average Caucasian American is considered obese if their body mass index is over 30. But for us, the cutoff is 27. So we are obese at a BMI of 27. We are overweight at a BMI between 23 and 25. So don't be lulled into complacency at that doctor's visit. Oh, your BMI is in the well range. The numbers are different. Our risks are different.
I really want them to know how easy it is for them to start to take care of their health. You know, it begins with what you're eating and putting into your body. You want to put fresh, whole foods, a variety of fruits, vegetables, whole grains, and less processed foods. You know, it's less about the details and more about the bigger picture. What are you really putting in your body? And if it's coming out of a package, it probably is loaded with salt and loaded with saturated fat, which is bad for your arteries. In addition to that, getting more movement in your day can be broken up. If you can't commit to exercise for a certain period of time, break it up. Take the stairs at work, park further away from the grocery store, but get that movement in, because the American Heart Association recommends 150 minutes of moderate intensity exercise per week. But you can break that up however way you want. Maybe it's 30 minutes, 5 days a week. Maybe it's longer workout on the weekend. But you gotta get that movement in, because we know that movement lowers your risk for heart disease. And I often tell my favorite TV watching patients to get up and stretch in between those commercials, because sedentary lifestyle, not getting up, sitting and for long periods of time, has been linked to worse heart health outcomes. So that's really key. It's not as hard. It's not about always going to Whole Foods or this organic store. It's about the simple things that you can do to make the whole family healthier and your whole life better. One other plug is, if you're smoking, quit. Smoking is so dangerous for women. It affects women more malignantly than men. And it's really key to kick that habit. And I can't emphasize enough how important it is to see your doctor regularly. Please don't just rest your laurels on the fact that you could think that you're too young for heart disease or that you're healthy. And we often get a lot of questions about supplements. Hafiza, what should people be thinking about supplements when they come to the cardiologist? And also, what do you do if you're vegetarian and you can't get, fish, which is really lauded in the cardiac world for its healthy features of omega-3s?
So it always surprises me that people eat foods that are completely processed and then think that a turmeric tablet, a ginger tablet, vitamin E and vitamin C are going to negate the effect of the food that came in a box with 5 unpronounceable chemical names. That's not the way it works, my friends. Food is medicine. Our bodies are in tune with absorbing nutrients from the source, which is our plants and vegetables. So I recommend the supplement I recommend is the DASH diet, a diet that is rich in colorful grains, vegetables, fruits, and nuts. So supplements are really for people who are deficient in something. And you won't be deficient if you have a well-rounded and well-balanced diet. So,
Not to mention, the DASH diet is the only diet that's been clinically proven to lower blood pressure at about 5 to 8 millimeters of mercury, no matter how much you prescribe to it. And what's key about the DASH diet, in addition to what you said, is the lower salt. We cook with so much salt. American chefs do, and so do Desi families. And that's because if you put salt in something, it tastes good. But we gotta start lowering salt. And the good news is the taste buds adapt, and we can all learn to develop that flavor for lower salt food.
and the same holds true with sugar. If you start thinking that aspartame, Splenda, NutraSweet, if that's the level of sweetness that you think is normal, well, the real level of sweetness that's normal is an apple or a strawberry, and those don't taste sweet anymore if you've ramped up to something artificial. But I know that several people in our South Asian culture are strict vegetarians. And if you or one of your family members is a strict vegetarian, then the one supplement I would suggest is, if you're not eating fish because of religious or dietary reasons, omega-3 fatty acids are very important for heart health, for stabilization of triglycerides. So I would suggest an algae oil supplement, which is a way to get omega-3s without taking fish or fish oil.
Great suggestion.
Fish oil and omega-3s in general as a supplement, Sheila?
I really prescribe by omega-3s. I mean, I really like the purest form, and that, a lot of our clinical trials have actually approved some of the, it's easier to say the brand name, Visceral. I really recommend that for my patients who have higher triglycerides, for sure. But I do recommend a lot of high level omega-3s. There's certain brands that I like, but I agree that algae oil for our strict vegetarian patients is an excellent source of omega-3s. You do need to double the dosages to get that level that we need for a cardiac benefit. But it's so important that when you're working on blood pressure, which leads to stroke and heart disease, you also start doing these other lifestyle attributes, as well as healthy supplementation for omega-3s, because it lines the coating of our arteries in the brain and in our heart.
So as we are realizing with this virus, our bodies are our fortress against the world. Unexpected things happen in the world, and we need to be healthy. And healthy is not just about our external appearance, it's what's happening inside of us, things that are depositing in our arteries, around our tissues. So we owe it to ourselves, our children, our parents, our cousins, our grandparents, to be as healthy as we can be, and to make sure that we take our family with us on this journey towards being healthier.
So true. So well said. So in closing, Dil Chahta Hai that you protect your heart and its health. Be aware of how you can make your lifestyle more healthy. Eat less salt. Eat a variety of foods that are fresh and not processed. Move your body and manage your stress. Emotional stress affects women's hearts more seriously than men. And be attuned to that. We take on a lot as women. And you really need to be aware that stress is harmful, not just for your mind, but for your heart as well. And get more sleep, eat lots of fiber, and stay attuned.
Yes, so thank you all for joining us, and please stay tuned because we have a live session coming up with Dr. Richa Mittal and Dr. Sonal Harder. They are internists, board-certified internists who specialize in wellness and culinary medicine. And we're going to be having a live session with them to talk about how we can implement the things that Sheila and I mentioned, like the DASH diet and the Mediterranean diet, and incorporate that into our Desi lifestyle and our Desi cooking. So stay tuned for that.